In the last couple sections, we talked about the osteology and the structure of the hip and the stability of the hip. And now we're going to talk about motion and osteokinematics and arthrokinematics and some innervation. So the hip allows 6 basic motions: flexion extension in the sagittal plane, abduction in the frontal plane, and internal external rotation in the transverse plane. So each of the 6 motions can use 3 different kinematic strategies. So open chain hip motion, and we'll talk about each of these. Maximizing trunk displacement through closed chain hip motion. So that would be like bending forward at your hips, if you want to think of hip flexion. And then there's also short arc closed chain hip motion. So the maximizing trunk displacement is long arc closed chain hip motion, and then there's short arc, and we'll talk about what those mean. So with hip flexion, it's the movement between the femur and the pelvis within the sagittal plane about a medial-lateral axis of rotation. And so we know that muscles that do hip flexion are going to have to be anterior to the medial-lateral axis of rotation. Okay? Put that little nugget aside and keep it handy for when we talk about the muscles. So hip flexion reduces the distance between the anterior aspect of the pelvis and the anterior surfaces of the femurs. So the picture A at the top of the long strip of pictures on the right here is open chain hip flexion. So we're bringing our knee up. Or if your knee's straight, that's also open chain hip flexion. So it's a marching motion or a straight leg raise if you have your legs, your knee straight. The long arc pelvic on femoral hip flexion, that is flexing your hips forward and your whole trunk comes forward. So in the picture on the left, the lady's bending over to pick something up. She's using long arc pelvic on femoral movement. So the pelvis is moving, the anterior part of the pelvis is moving towards the anterior surfaces of the femur, and the whole trunk is going along. Okay, that's that. Long arc closed chain hip motion. Long arc pelvic on femoral. In that second picture, she is still taking the anterior aspect of her pelvis towards the anterior surface of the femur, but the trunk is not having as much displacement, and we just have a small anterior pelvic tilt. It's still hip flexion, but it's a short arc pelvis on femur motion. Okay, so in the pictures on the right, it shows the bending over is the long arc pelvic on femoral hip flexion, and then it has a seated anterior pelvic tilt, which is the short arc. So it can be a standing or seated anterior pelvic tilt for that short arc pelvic on femoral closed chain motion. Hip extension has those same 3 options. So hip extension is the movement between the femur and the pelvis within a sagittal plane about the medial-lateral axis of rotation. We note in order to get extension, the muscles have to be posterior to the medial-lateral axis. Okay, so that's given us a clue as to which muscles are going to do hip extension. Hip extension reduces the distance between the posterior aspect of the pelvis and the posterior surface of the femurs. So we have those same 3 kinematic strategies: open chain hip extension, which is the picture on the top, closed chain long arc pelvic on femoral hip extension, sort of like a back bend, and closed chain short arc, which is a posterior pelvic tilt. You're still decreasing the distance between the posterior aspect of the pelvis and the posterior surface of the femurs, but the trunk is not going along with it. So it's really the position of your trunk determines whether it's a long arc or a short arc. Hip abduction, it's in the frontal plane, the movement between the femur and the pelvis, about an anterior-posterior axis of rotation. If we're going to do abduction, we need a muscle that is lateral to the anterior posterior axis of rotation. So think about what muscles those might be. If you want to, before you listen to the muscle lecture, write down what muscles you think might do hip abduction. And then when we go through the muscle lecture, you'll see if you were right. So hip abduction reduces the distance between the iliac crest and the lateral aspect of the thigh. If you want to think about muscles that do hip abduction, it reduces the distance between the iliac crest and the greater trochanter, which is on the lateral aspect of the femur. So open chain hip abduction is that top picture. The femur goes out to the side. Closed chain hip abduction, we're reducing the distance between the iliac crest and the lateral aspect of the thigh, so it results in an ipsilateral side bend, if you want to think of it that way. Hip adduction is the movement between the pelvis and the femur in the frontal plane about an anterior-posterior axis of rotation, and we know that the line of pull of the muscles has to be medial to the anterior-posterior axis. So what muscles do you think might do hip adduction? Hip adduction results in a reduced distance between the midline of the pelvis and the medial aspect of the femur. So open chain hip adduction, the femur moves in towards the midline. Closed chain hip adduction, the contralateral side of the pelvis drops down, so the midline of the pelvis moves towards the midline of the femur. With internal and external rotation, they occur in a horizontal plane about a vertical or longitudinal axis of rotation. So the pelvis is rotating around the femur, if that makes sense. Either if it's going if the pelvis is moving medially, it's internal rotation, and if it's moving laterally, it's external rotation. If the anterior part of the femur is moving medially, it's internal rotation. If the anterior part of the femur is moving laterally, it's external rotation. Hopefully that was crystal clear. So if we want internal external rotation occurring in a horizontal plane about a vertical or longitudinal axis, we need muscles that run either horizontally or obliquely from the midline, from medial to lateral for internal rotation, and from lateral to medial for external rotation. Okay, so think about what muscles those might be. The arthrokinematics of the hip joint are based on a convex femoral head moving within a concave acetabulum. So abduction, adduction, internal, external rotation involve roll and slide in opposite directions. During flexion and extension, the femoral head spins in place about a medial-lateral axis of rotation. So it's a little bit different from shoulder because of that 125-degree bend from the shaft of the femur to the neck of the femur, that angle of inclination. It changes our roll and slide mechanics a little bit. So when you get in the lab on April 21st and 22nd, grab a hold of a pelvis and a femur and try that out and see what happens to those joint surfaces. So the innervation to the muscles of the hip is actually pretty simple, which is yay. Isn't that nice? The femoral and the obturator nerves are the two largest nerves that exit the lumbar plexus. The femoral nerve innervates most of the hip flexors and all of the knee extensors. The obturator nerve innervates primarily hip adductor muscles. So if you know that a muscle has a line of pull for hip adduction, you know that it is innervated primarily by the obturator nerve. If a muscle has a line of pull for hip flexion, you know that it's innervated by the femoral nerve. So sometimes the organization helps you out and sometimes it doesn't. This is a case where it does. Yay. And when we talk about the individual muscles, we will mention the innervation as well. So the sciatic nerve is the largest nerve in the body. It arises from the sacral plexus, and it's composed of the tibial nerve and the common peroneal nerve. So you can sort of think of it as, you know, when you get a new set of headphones and they're all joined together all the way to the end, and then you have to peel them apart so you can take the headphones apart and put one in each ear. You can think of the tibial portion and the common peroneal portion of the sciatic nerve as being those two sides of the headphones. So you peel them up apart. At the top, where they're plugged into the sacral plexus, it's where the cord is together, and then towards the inferior portion, it's where you've peeled those two headphones apart. That's my analogy for the sciatic nerve. So the tibial portion of the sciatic nerve innervates most of the hamstring muscles and the extensor head of the adductor magnus. So if you think about it, extensor muscles of the hip are innervated by the sciatic nerve, tibial portion, and the extensor head of the adductor magnus. There's also an adductor head of the adductor magnus, and that is innervated by the obturator nerve. Okay, it all makes sense. The common peroneal portion of the sciatic nerve innervates the short head of the biceps femoris and a whole bunch of other muscles lower in the extremity that we will talk about in another chapter. So we do have some other nerves from the sacral plexus that innervate the gluteal muscles, the tensor fasciae lata, and the deep hip rotators. So they're largely named either by the muscles that they innervate, like the piriformis to the piriformis nerve. The inferior gluteal nerve innervates the gluteus maximus, and the superior gluteal nerve innervates the gluteus medius and gluteus minimus. So when we're talking about the muscles, we will address those ones particularly. But if you put your hands on the gluteus medius, it is more superior than the gluteus maximus. So superior gluteal nerve for the gluteus medius and inferior gluteal nerve for the gluteus maximus. It makes sense by where they're located.